Multiple sclerosis is a neuroimmunological disease. It's a problem where the immune system causes inflammatory reactions in the brain, spinal cord, and/or optic nerve.
You can have different symptoms. Sometimes that's numbness and tingling, sometimes it affects the optic nerve, so you can have visual changes. Sometimes it can affect your spinal cord, so you might have changes in how you're walking, or things like balance. So it really depends on what area is attacked initially.
It was about 5 years ago that I was first diagnosed with MS, and the onset was quite sudden for me. I suddenly lost feeling in the bottom half of my body, my legs. Prior to that sudden onset, and noticed things that were wrong. I was tripping a lot. I broke a couple bones because I did clumsy things. And now, of course, I know what it was, but it was not enough to really seek medical attention about until the onset.
I was diagnosed on April 7th of 2011. It was the day I thought I had an ear infection. I hadn't been feeling well and went into the hospital and ended up being admitted and subsequently found out that the reason was MS.
Symptoms are so unique, and depending on what things you do for hobbies or different activities, it might impair one person in a different way that it impairs another.
I woke up one morning with a pain in my shoulder that brought tears to my eyes and went through a process of diagnosis that finally got to MS.
I have had MS for 9 years. I came across Dr. Glisson, and he was just so positive.
Kim came to see me because she had optic neuritis, which is an inflammation of the optic nerve that causes pain around the eye as well as vision loss. Fortunately, optic neuritis has a very effective treatment, and the vast majority of patients completely recover. In Kim's case, she recovered vision back to normal and has been able to maintain that over the last several years with treatment and with careful follow-up.
When I was immersed into this community of multiple sclerosis, I've met so many wonderful, amazing people.
We have a support group that meets periodically, on a monthly basis, that brings together patients and their caregivers. More importantly, there's a community experience.
If you're recently diagnosed, you just haven't had time to think about this and process it and ask yourself what it means, and try and envision the future for yourself, and the group can help you do that.
Hearing what other people have experienced and how they've dealt with it is so helpful, and the adaptations they've made are inspiring. It makes me maybe want to try this or that.
I realized there were a lot of things in life that I was missing, that I was not paying attention to because I had become so kind of driven and focused and into work and not paying attention to some of the more important things in life. MS is very much a day-by-day disease, so you learn to live in the moment.
When this clinic was developed, it was under the premise that we really needed multidisciplinary. We started with one of our neuro-ophthalmologists, a neurologist, myself, and then worked very closely with our therapists, including speech therapy, physical therapy, occupational therapy, and our social work, to gain knowledge and fine-tune the program to really what the patients wanted and needed.
At the time when Dr. Sullivan and I decided I should no longer be working, it was almost as if he snapped his fingers, and there was a social worker to help me through that maze of paperwork, had all the things on hand that I needed.
Dr. Sullivan has been amazing. What I think I appreciate most about him is that he takes the time to explain things to me and not dictate things to me.
This is a disorder/disease that is a bit unpredictable, but the majority of patients live fruitful lives. They remain employed, they have families, they travel all over the world. So this is something that can be managed in a way that lessens the effect of the disease.
Patients with multiple sclerosis have a much better outlook than they did even just a few years ago. We have gotten so much better at helping patients to manage their symptoms and feel as if they have the ability to do whatever it is that they want to do.
Your life goes on, and it goes on, you know, in very good ways.
When anybody asks me where they should go for the best care, I think Mercy Health stands high above the others because of the quality of care and the team that works with each doctor.
I really was impressed by the Hauenstein Neuroscience Center because I feel comfortable and at home and taken care of, and the care that I receive here is second to none.